Good day to all listeners. This is a video on the common doubts that women have when they are undergoing a pregnancy. I am Dr. Shobna Mohandas. I work as a gynecologist in Thrissur, Kerala, and I would like to share some of my viewpoints that I think patients have during this period. The common doubts that they have, one of them is that, can I work? Should I stop working? Should I give my resignation and things like that? But basically, work need not be stopped, but there are some occupations where you have to stand for more than 4 hours and you cannot stop the occupation. So take care to sit or walk in between, take adequate rest in between your work, like teachers, nurses, sales girls, police women, people like that. Because if you stand at one single point for a very long time, then you can have swollen legs due to deep vein thrombosis. You can have varicose veins in your legs. And so here, besides what I said, you can even buy some stockings to reduce your varicose veins, buy belts to give a comfort to your back. It's all available online. And another thing is, a lot of people work in organizations where there are no lifts and they have to climb a lot. Maybe you just go and climb at one go and don't keep going up and down, but you have to avoid falls. Unless you are absolutely fit, please don't do it. You have to be fit, and your condition should be such that you are allowed to climb stairs by your doctor. Even when you do that, don't run up and down forgetting pregnancy. You have to avoid falls, avoid bleeding, and especially in patients with twins and miscarriage and people who are dizzy, do not climb stairs. Only in uncomplicated pregnancies you can climb stairs, can actually build the stamina of the woman, especially in the last 3 months. Months. Make sure you don't fall. Uh, See if the stairs are not good, so you have to be careful there. You don't have tangling clothes and get stuck in it like churidas, chunnis or something like that. When you're feeling strenuous, when you're feeling giddy, when you're feeling stressed out, then you stop. Give yourself, uh, you know, stop, rest, and then you don't have to do it. Don't force yourself to do it. So, which are the exercises to avoid in pregnancy? I can say that most of the exercises are allowed in pregnancy. What you have to avoid is working for a long time in excessive humid climates, like that worker there, or even civil engineers and people like that. In You have to understand that you're pregnant and take rest, and be careful because you'll sweat a lot, and that's not very good for you. And heat itself can have its own problems. Rapid changes of posture should be avoided, so that just because you're allowed to exercise, don't choose exercises which make you change positions very rapidly. Squatting, just like taking out weeds for a long time, that should be avoided. Whenever you do any exercise, please do hydrate yourself before the exercise. And if you have shortness of breath, vaginal bleeding, numbness, fatigue, back pain, anything, please do stop the exercise. In patients with hypertension, asthma, risk of miscarriage, or any other things where the doctor advises rest, you cannot be doing exercise. So, in all other cases, which is almost 80%, physical activity does not increase your chance of low birth weight, early delivery, or early pregnancy loss in normal patients. They should be normal patients. They should do at least 150-minute exercise, moderate intensity, like brisk walking, or many exercises are there online, or even with the gym. If you go, they will teach you, or yoga specialists can teach you. So this will improve your stamina. In fact, if you are a runner before pregnancy, you can continue. Don't start running just after pregnancy. Why, in some cases, doctors advise rest? Because in selected cases, if you don't take rest, there is a lot of stress that can cause pregnancy loss. Blood pressure can be reduced if you take rest. There is less pressure on the cervix, which is the lowest part of the uterus, and the baby is stuck on that. And so when you take rest, the baby's head won't hit against it. Again, the placenta supplies blood to the fetus. So if all the blood goes to the muscles while exercising, it won't go to the placenta, and so the baby won't get it. That's one reason why bed rest is advised in a few cases. What about travel in pregnancy? Everybody's jet setting these days. They would like to travel by air. It's allowed almost up to the last month, but you have to stand for long in an airport. So do use compression stockings, use comfortable shoes, which you don't have to buckle up on bending. Use slip-on shoes. Take a lot of water. Use belts if you think it is comfortable. And there is a tendency for women to get repeated UTI, urinary tract infection during pregnancy. So while traveling, it would be good if you can use some toilet covers which are available online and use that on the public toilet so you do not get urinary tract infection. Small little things can go a long way in your pregnancy. Train travel is by and large safe till the last month, provided your pregnancy is absolutely normal. You can't be delivering in the train, so you have to take precautions on that. Even in bus, when you're nauseated, you have to take precautions on that. And sitting for long, standing for long, jerks should be avoided, preferably short travels, but some people have a long travel to do, either in bus or in train. But make sure you have your walks in between, or not continuously sitting for 1 or 2 hours. Sometimes in local trains or metros, you have to travel along. Be careful about the walking in between and sitting properly. Car and autos are okay, but driving, provided you're not dizzy and you're safe and you're absolutely healthy, you can even drive your car till the last trimester. Scooters and motorbikes are a little tricky because there are risks of accidents. And then when you fall down in the middle of the night, you call your doctor and say, "Is my baby safe? Come on, do a scan. Just now, I want to know if my baby is safe." So this sort of panic situations can be avoided if you avoid mobile travel during pregnancy. Again, even if you use a helmet, when you remove it, you are exposed to a lot of pollutants in open travel, and that can cause increased infection. Vibrations and jerks will eat up a lot of the blood supply to the muscles, and your baby can be affected. Back pain, hip pain, and discomforts are all more in back pain when you're traveling with the pregnancy. And so, in spite of many videos advising it, my personal advice to you would be to avoid traveling in motorbike or scooters. And sex in pregnancy is safe in most cases. If not, the doctor will advise you when to stop. So thank you so much for listening to my talk here. And I hope it has been useful to you to allay many of your doubts. Thank you so much.